So we are looking at this is a continuous positive airway pressure. So you can actually employ this for respiratory distress syndrome. Okay, so that's in newborns that have respiratory distress syndrome, or in older children that have respiratory distress syndrome, or adults that have issues with breathing. So for continuous positive airway pressure, so that is a widely used and effective non-invasive respiratory support strategy is used for what? Managing respiratory distress syndrome. So in respiratory distress syndrome, just like the name implies, one of the most important issues that the patient is facing is they are having difficulties in breathing. Okay, so forget that I use images of what matured people in this lecture. Particularly, they are very effective in newborns. Okay, they are struggling to breathe. So what is the use of this continuous positive airway pressure, okay, in a child that is struggling to breathe? So it maintains alveolar stability, it reduces the work that the child has to do for them to be able to breathe. Okay, also applies to adults, minimizes lung injury. Okay, so in neonatal respiratory distress syndrome is the first line of support because the child is actually having a lot of issues to breathe. And you should know that these children are born before their time. So it's usually given through the nasal, okay, max, okay. That's how prongs or max. So starting pressure is about 6 to 8 centimeter water, okay. Adjusted based on what? How the fetus is needing oxygen, okay, and the clinical response. So alternatives, if you are not using the CPAP directly, you can go for nasal intermittent positive pressure ventilation. That will do a different video on it. Have the bi-level one, okay, CPAP, then the high flow nasal cannula. Okay, so you can also consider surfactant therapy, where you know that the baby is having difficulties in keeping their lungs open, so you can be giving surfactants to basically keep the lungs widely open. So failure rate, despite its benefit, 25 to 50% of infants may still require what? Mechanical ventilation. Okay, so close observation of oxygen saturation, blood gases, and respiratory efforts, okay, should actually guide how you are using it, how you're actually adjusting it, and all.